with this, and then we move to slide share. And okay, so we are going on with our studies, and today we are going to speak about instructions and procedures and how to give instructions to different kind of procedures. So I mean that I don't have any questions to your home task that you've submitted to the Moodle platform. Everything was okay, and almost everyone has done this. So there are some students who haven't done this task, and I mean that you lose your points, your score, if you don't submit the task. Don't forget about this. Well, today we are going to speak about now first about what is happening in the pictures. So you see here there are some doctors. What are they doing? Doctors and patients, maybe other people. So can anyone say what is happening in the pictures, and what do you think happens before this and after this? Yes? Is anyone eager to speak? Okay, Arun Chalam.
Yes, ma'am. Ma'am, in the picture here, the doctor comes from a room, ma'am, to tell the patient what has happened, to tell the patient's relations outside what is happening to the patient and what that he does. What treatment does he do, what surgery he did, ma'am. The status of the current patient, then, ma'am.
Okay,
And then
what do you think? I'm sorry to interrupt. What do you think will happen next? I mean, what does the doctor offer to the patient to do?
Doctor offers that you can see the patient in some time when her vitals get normal. And then,
ma'am, doctor is offering clothes to patients to change.
Okay. Maybe the doctor offers the patient to lay down, to undress before taking some kind of investigation or test.
Yes, ma'am.
Okay, thank you. In picture B, Madhumita, what is happening there?
Maybe the doctor is writing down the history of the patient.
Case history. Great. Yes, good. So in picture C, let us listen to Divya. What is happening here? Divya, are you here?
Ma'am. Ma'am, the doctor is checking the patient.
He's touching the patient, yes?
Yes, ma'am.
Okay. And is he talking about anything? What do you think? Look at the age of the doctors. The doctor who is dealing with the patient, how old is he? Is he older than the other two doctors?
He might be the senior doctor of that particular hospital.
Senior doctor. And the senior doctors, what do they, what can they do to the junior doctors?
They teach their juniors
to their juniors
or their assistants.
Explaining the procedures, ma'am.
Yes.
They
explaining something, showing the procedure. Yes, helping them in future. Okay. So, okay, good. If we move to the next slide, here the same questions about picture D. Let us listen to Priya. Priya, please. Is Priya here? No.
Ma'am,
Priya.
doctor is inspecting the patient.
Mhm. He's talking to the patient.
Is
Is
he inspecting the patient?
exactly. Mhm. And the other people next to the doctor, who are they?
Ma'am, they are the practicing students, ma'am.
Okay, possible. Mhm. Yes,
Maybe
some kind.
next one row.
Mhm. Or maybe junior doctors, right?
Yes.
Or consultant, also possible.
Yes, ma'am.
Okay, let us listen, let us have a look at picture E and listen to Raj Kumar.
Ma'am, he's not there in the session, ma'am.
Nice, Raj Kumar. So, and Badris.
Badris is also not there.
So this is not the first time, this is the third time in a row that they do not attend the classes. So, Prerna,
Yes,
Prerna,
ma'am.
picture E. Can you comment on picture E, please?
Ma'am, the doctor might be talking to the nurse or what we call them.
Mhm. So the woman is asking another doctor to help her.
About the situation or what had happened to the patient
Mhm, mhm. Some kind of a business
after
conversation.
the treatment. Yes, ma'am.
Okay. Mhm. So, and the last picture, let us listen to Nishat.
Yes, ma'am.
So please.
In the picture F, the two doctors are having conversation over a case, ma'am. Like they're discussing some case, ma'am.
Mhm. And one is one of the doctors yawning. What do you think?
Yes, ma'am.
Why?
Like maybe the white coat lady case is
Ma'am,
like
maybe they're
he's
interested.
giving instruction.
It can also be that he's gossiping something like he wants to
Okay.
speak something slowly.
I think, ma'am, they are interchanging the shifts, ma'am.
Exactly, yes, because the man is tired and he's handing on
Yes.
the shift to another doctor. Fresh
Maybe
and
they're checking the progress of history or progress of patient.
Patient.
Mhm. Yes, just to know that the other doctor knows everything about what happened during the first shift. Okay, so and
Yes, ma'am.
okay, thank you. And everything what is happening here is happening in a ward, right? So
Yes,
in a
ma'am.
hospital.
Yes.
And let us have a look at the definition for a ward. A ward is a separate room in a hospital, typically one located in a particular type of patient. And I would like you to think about your own experience in a ward for the first time. Have you ever been in a ward? You, yourself.
Yes, ma'am.
So why? Can you tell us about this case?
Ma'am, in the ward, the patient present there, and when I saw the nurses checking the patient for a particular time. They had some intervals of time, and at that interval, they came and they checked their normal condition and what and all they are going through. Are they doing well before, after the medicines, or did they took the meal? Did they took the medicine? And if they are advised to take injections, so they inject them, and so and so.
Mhm. Mhm. So you
After some interval of time, doctors also take round, and doctors also ask the patient as well as the nurse about their medical condition.
great. You're speaking about your experience not as a patient, but as a person who just observed the work of the
Ma'am,
people.
I was talking about the person who observed. I
Mm,
was not the patient.
I see. Great. So you are speaking about this from the professional point of view. Okay, very good.
Ma'am, I
Now-
think it is a case where patient is admitted, basically.
Mhm. Okay.
Yes, ma'am.
Okay, thank you. Let us move there. And here there is another term that we should remember about. This is a ward round. So the ward round is very important to visit of a doctor in a hospital to each of the patients in a ward. So this can be done just every day in the morning or several times a day. You know, when during the ward round, doctors listen to the patients, they give some kind of prescriptions, what should be done with every patient. Well, this is very important in the work of any kind of hospital. And now there are some tips here on this slide. So the tips for a first ward round, so which an experienced doctor is giving to a junior doctor. So let us have a look at these tips. And the question is, why do you think each tip is given? What for is each tip given? Let us listen to Prakriti. Prakriti, are you here? No, minus. So, Samhita.
Yes, ma'am.
So the first one, read it, please.
Make sure you know the name of the. Make sure you know the names of the patient and where they are. Ma'am, actually, this tip is given because the doctor should know the what whom they are speaking to, and from particularly if they are from the same region or they have came from some other part of the region. Like I have some multi-specialty hospitals which are 60 to 70 kilometers far from my home. So I think that's the reason this might be given. And if they are from some different region, then their family members have to come at a time span. Like some one day my brother was admitted, so my father used to go, then my mother used to go, then I used to go at a different time span.
Don't forget that we're speaking about a ward round. So where the patients are means which bed each patient is located. So,
Yes, ma'am.
mhm. Okay, thank you. Okay, about the B, just tip, piece of advice. Let us listen to Rafe. Is Rafe here?
Yes, ma'am. Find out from the bed managers if any patients have been moved and to where.
Mhm.
Ma'am, it is important to find out where the patient is, ma'am, since if, for example, ma'am, if a nurse takes some tests and all, ma'am, and soon immediately after that the patient is moved somewhere else and some other patient is brought to that place, then the doctor may be confused, ma'am,
Mhm.
confused about the patient. So it is important for the doctor to know where exactly the patient is moved and all.
Yes, exactly. Okay, thank you. So the next C is for Ayman.
Yes, ma'am. Ma'am, the statement is check that all the case notes, investigation, and so on are on the wall, ma'am. Ma'am, this tip is given because I think in case of any emergency, it will help as a quick reference, ma'am. These case notes and investigation. If there is any kind of emergency, it will be very easy to take them and refer about the patient.
So, and on a ward round. So
Yes, ma'am.
it is important because the doctor should know what kind of tests and
Yes,
investigations
ma'am. Yes,
were
ma'am.
done before,
They are undergoing in.
just to prescribe some treatment, right? Mhm.
Yes, ma'am.
Okay, so then the next line is for Arun Chalam.
Yes, ma'am.
Read it, please.
Invite a nurse who knows your patients to come on the ward rounds. That is to accompany with the doctor and to give the sudden any update of the patients, the recent status of the patients, ma'am, so that the doctor can analyze easily and can prescribe the medicine soon, ma'am, and to have the case notes with the nurse, ma'am, to have some good reference of the patients, ma'am,
Exactly.
of the previous
Great.
sudden history. Yes, ma'am.
And just to help the patient to calm down, right? Because
Yes, ma'am.
patients
Yes,
are
ma'am.
closer to the nurses.
Yes, ma'am. Thank you.
Okay, thank you. And the next one is for Madhumita.
Record case histories and results clearly and concisely. Because when a doctor or a nurse shifts from their duty, another new doctor will come, and if he wants to know about the patient, he'll read the history, ma'am. If it is clear, he'll not have any doubt.
Exactly, yes, just to help each other, right? So good. Now we are moving to the listening task. So we should listen and complete the reasons given for each tip, what we were doing, we were just doing, and we should understand what the experienced doctor is talking about and complete these 5 phrases using more than 5 words, no more than 5 words for each gap. Do you see these are the phrases taken from the conversation, and you should listen what comes after this phrase. Okay, now I'm going to switch on the recording and you'll tell me if you hear or not.
Unit 3, Listening 1.
Do you hear?
Yes,
Yes,
ma'am.
Yes, ma'am.
Okay.
Yes, ma'am.
Okay, let's get started.
Unit 3, Listening 1.
There are many things that will become obvious once you have done your first ward round, but I can give you a few tips that helped me on my first day. The first thing is, make sure you know the names of all your patients and where they are in the ward, as you want to demonstrate that you are familiar with your patients. The next tip is always check with the bed managers if any patients have been moved, and if so, where to, in order to avoid wasting time, especially the consultants, running around looking for patients. Also, make sure you have all the case notes, x-rays and so on hand so that you can refer to them quickly. It is useful to invite a nurse who knows your patients to come on rounds with you, because they may be more knowledgeable about the patients on the ward than you are. As regards the case histories and results, record them clearly and concisely. In that way, you can access information easily.
So this is very useful information for junior doctors. So have you managed to understand and put down all the words, or do we need to listen for the second time?
No, ma'am.
No second time?
take second time?
Okay, yes, let us listen because there are a lot of information. You know.
Unit 3, Listening 1.
There are many things that will become obvious once you have done your first ward round, but I can give you a few tips that helped me on my first day. The first thing is, make sure you know the names of all your patients and where they are in the ward, as you want to demonstrate that you are familiar with your patients. The next tip is always check with the bed managers if any patients have been moved, and if so, where to, in order to avoid wasting time, especially the consultants, running around looking for patients. Also, make sure you have all the case notes, x-rays and so on hand so that you can refer to them quickly. It is useful to invite a nurse who knows your patients to come on rounds with you, because they may be more knowledgeable about the patients on the ward than you are. As regards the case histories and results, Record them clearly and concisely. In that way, you can access information easily.
Okay. So please, Divya, what is missing in the first? What did she say in the first tip? What should we add here?
Ma'am, as you want to demonstrate that you are familiar with the patient.
Exactly. Mhm. Yes, you're right. Well,
Thank you.
the next is for Priya, please.
Yes, ma'am. To avoid wasting time running around, looking for the patients, ma'am.
Mhm. Great. So then the next is for has Raj Kumar come? No.
No, ma'am.
What about Badris?
No, ma'am.
No. Prerna, please. Prerna.
Yes, ma'am. So that you can prefer the X-rays.
It was the tip about taking the case notes.
Case.
The case notes should be on hand, so
that they can refer to them quickly.
yes, refer to them quickly, to all kind of papers and tests. Okay, the next is for. So where did we stop? Prerna, yes. Nishat, please. Nishat.
Yes, ma'am. Make sure to take nurse with you because they may be more knowledgeable about the case, about the patients in the case than you.
Who is more knowledgeable?
Nurse, ma'am.
Nurse. Great. Okay. Then Prakriti. Is Prakriti here? No. Samhita, please.
Yes, ma'am. Ma'am, note should be written in a concise manner so that it can be easy for everyone to understand.
To access
Concise and
information.
Results.
To
Yes,
access
ma'am.
information easily. Okay, great. So here we are. And
Unit 3.
now the question is, would you give the same tips to a junior colleague in this situation? What do you think? Are the tips useful?
Yes, ma'am. All these tips are
Yes,
really
ma'am.
useful.
Yes, ma'am.
They are useful.
And do you have any additional advice that you would give? Any other pieces?
I think
Yes.
the doctor should also on personal level should know the patient.
On personal level.
Always looking for nurses and for other people. He should also know them on personal level, if what is all the history and what is going on. He should personally check on that.
Why is it important?
Ma'am, if the caretaker, the main nurse who is looking for the patient is not there, if in any case, so ma'am, doctor, it will be very useful for the doctor. He can work without the nurse also then.
Yes, ma'am. And moreover, these people are his patients. He should be responsible for them, ma'am. I'm grateful to go the treatment.
Okay. And
we would listen to the doctor.
Yes, please. Okay. I see. So, and you remember that taking a case history, doctor asks some a lot of personal questions about the background, patient's background and his family. That is why it's very important to know everything in details. Okay.
Oakridge method.
Like their allergies. Maybe they are
You know about
allergies of
their
medicine.
history, ma'am. Ma'am, their history. You know about their history.
Yes, you're right. Okay, let's move on. And so why do you need to do these things before you carry out some kind of procedure. So the first just thing you should know you need to do is to obtain consent from the patient for the procedure. Why do you think it's important? So let us.
Because
Okay.
no,
The
without the
person-
consent of the patient, we couldn't do anything, ma'am. Because we're treating that patient, the patient should feel the most comfortable and should be satisfied with what we are doing, ma'am. So the consent is very important.
Okay. So the patient makes a decision about the procedure, about his treatment, because it deals, doctors deals with the patient's health. Okay. Why is it important to introduce yourself?
So that the patient should know who he is being treated by.
Okay. In case of emergency, as you say, right? Okay. And why is it important to prepare the trolley? The trolley is given here in the picture. Why is it important before the procedure?
Ma'am, because we cannot run from one place to other for different things. So it should be in.
We should have
And
all
also we
equipments in one
cannot
place.
ask the nurses or any other person to bring this or that, so that they prepare the trolley and keep it near themselves.
Like
Yes,
they
ma'am.
are, they are having equipments and other useful products for treating the
Whatever
patients in
whatever equipments they
convenient
need
manner.
for the particular
Very easily, ma'am, one place to another place.
Ma'am, all the surgical equipment should be quickly accessible, ma'am.
Yes,
you're right.
Also,
Okay.
ma'am, if you should not be present in our ward, then there will be a chaos in the ward itself. That bring this, bring that, go to that room. To avoid that chaos.
Exactly. Okay.
Ma'am, and
And-
also avoid
yes.
the microbial attack, ma'am, on equipment.
Okay. So, and here we have some vocabulary just that we should use correctly in describing a procedure. Here there are instructions for a procedure, and we should use the words which are given here in different colors to complete the instructions for a procedure. All the sentences are mixed, and you can see some pictures that illustrate some words which are mentioned in these sentences. And so the words which we need to use in these phrases are prepare, mark, attach, wash, sterilize, drain, obtain, withdraw. Do we understand the meaning of all the words here?
Ma'am, actually the yellow word is not visible.
Which word?
Mark.
Mark,
Yes,
yes. So everything is clear, right?
Yes, ma'am.
So if you don't understand, ask the other students for translation. Do you know withdraw?
Yes, ma'am.
Okay.
Ma'am.
So let us have a look at the sentences and decide what is missing in sentence A. Madhumita.
Is that dash the stylet? Maybe sterilize.
Okay, possible. Or
Prepare
also.
Prepare the salad.
What else is possible?
Ma'am, it could also be withdraw, ma'am.
Withdraw.
ma'am.
Remove.
Silent. Okay. So the next line is for Divya.
Yes, ma'am. Drain 10 drops of CSF into 3 specimen tubes.
I think
prepare.
Cerebrospinal fluid.
Yes, ma'am.
Okay, so what is?
Ma'am, it's also withdraw. It's also withdraw.
Okay.
Drain money.
Drain.
It would
and not withdraw.
Train,
Because
ma'am.
it is
Or
saying
withdraw,
into the
yes.
tree and do.
Okay, let
Ma'am,
us, yes, let us listen to Priya for the next line. C, please.
Yes, ma'am. Mark the point between L3/4 where the needle is to be inserted.
Mhm. So L stands for lumbar vertebra.
Lumbar
vertebrae.
vertebrae.
Mhm. It's given at the bottom. Okay, Mark, yes, the only one possible. Then let us listen to Prerna.
Yes, ma'am.
D line.
Dash your hands and put on sterile gloves. Wash your hands and put on sterile gloves.
Exactly. Then Nishat, please.
Yes, ma'am. Dash consent for the procedure, ma'am. Prepare consent for the procedure. Or maybe
Obtain
attach
consent.
consent.
Or
Obtain consent.
From the patient, yes, okay.
Yes.
The next is for Samhita.
Ma'am, the word could be dash the area, mark the area of patient's back,
Sterilized area.
sterilize the area.
Sterilize
Sterilize the area.
Okay, yes.
Ma'am, it's
Nearly.
also the wash the area. Yes, ma'am.
Wash the area of the patient's back, okay. Then let us listen to Rafael.
Yes, ma'am.
Prepare the
Dash
area of
the
patient.
equipment on the trolley. It could be either sterilize the equipment on the trolley, ma'am. It could also be prepare the equipment on the trolley, ma'am.
Okay.
Also sterilize, ma'am.
Sterilize.
Sterilize
Is
the equipment on the
equipment
trolley.
sterilized on the trolley?
Yes, ma'am. The
Okay.
equipment should be sterilized.
I mean, is it sterilized on the trolley or somewhere else? In
No,
another
ma'am.
place?
It's sterilized somewhere else, ma'am, and kept on the trolley.
I see, okay. And you know better. And I mean, please, the last line here, please.
Last is, ma'am, the manometer. So, ma'am, it could be prepare the manometer or mark the manometer. I think.
Yes, ma'am.
There is only one word
I think prepare the manometer.
which we haven't used yet. This is attach the manometer.
Attach the manometer, ma'am. It's measuring the CSF pressure.
Yes,
Pressure. It measures the pressure.
Yes.
Pressure.
Yes, okay. Let us move on. What do we see? So withdraw the stylet, drain the drops of this fluid, mark the point, wash your hands, obtain consent to sterilize the area of the patient's back, prepare the equipment and attach the manometer. So here are the answer to this task. Can we write these steps in the correct order? I mean, what comes first? If we speak about procedure, what should a doctor or a nurse do first during this procedure? What is the first step?
Obtain consent for
First,
procedure.
to take the consent from the patient.
Obtain the consent for the procedure.
Obtaining the consent or
For the procedure.
or
Sterilize the area of the patient back.
No, no.
No, ma'am.
Wash
that is
your
sterile.
hands and put on sterile gloves.
before
Yeah.
the doctor should prepare the equipment on the trolley,
Equipment on
right?
the trolley, yes.
Okay, so it seems like we have less than 1 minute. So let us just stop here. Yes, and we are meeting in 10 minutes, okay?
Okay, ma'am.
Okay, ma'am.
See you.